Join Marty Johnson, the holistic health practitioner and founder of Total Health Nutrition Center in Menominee Falls, Wisconsin, as he delivers these podcasts to enlighten you and give you hope that there are health solutions to conditions that seem difficult to resolve, or even better answers than a medical approach of prescribing a chemical drug, which most times is nothing more than a Band-Aid fix, rather than getting to the root cause of your problem. The mission of the Total Health podcast is to provide the education and support that will lead to transforming people's healths so they can live a much more efficient, productive, and happier life the way God intended it to be. Join him now for his latest podcast.
Okay, so the last podcast on digestion, I was talking about the small intestine and leaky gut, and even we went in a little bit about how that can lead to autoimmune issues, like rheumatoid arthritis, Crohn's, colitis, thyroiditis, which is Hashimoto's thyroiditis. A lot of these molecules of toxins that can get through the small intestine when that small intestine, the walls of that small intestine open up and allow these things through, the immune system has to try to modulate and handle those things and go after them. And if it can't handle them well enough, it's going to go after healthy tissue and start to damage healthy tissue and cause inflammation, which is what the immune system does in the process of trying to help you. But that inflammation can become very damaging and cause problems in multiple ways. So the way that we deal with that from a clinical standpoint is to look at, number one, if a pancreas has been beat up over the years because of a lack of raw foods in the diet. So in other words, like some raw fruits and raw vegetables and even some meats that are not grossly overcooked have their own enzymes in them, which actually help in the process of digestion. The problem that we have is that in our society of processed foods and packaged foods, we have a lot of intake of food that is dead, meaning that there's very little or none of the actual enzymes that food would originally have in it. So the pancreas has to do all the work to digest. And that puts a big load on the pancreas over many, many years. And after a while, that pancreas may not be producing as much of the enzymes that it should. So in this case, we would start to introduce pancreatic enzymes in a supplemental form to kind of help things out, give that pancreas a break and help your digestion to start working better. When it comes to the leaky gut aspect of things, we want to do a number of, we coach people through a number of different processes, and of course, each person may need to do different things depending on what their situation is. But processes that start to include intermittent fasting, where there's a little bit longer time from the day before. In other words, when you ate last the day before till the time that you eat your first meal. So if we have longer times in between, so in other words, if you normally go 10 hours between your last meal of the day before till breakfast, then maybe you start to push it out 12 hours, which gives your digestion longer to heal and allows inflammation to settle down in your body. And while we're doing that, adding in different nutrients that can start to heal that lining of the small intestine, things like collagen from bone broth, or glutamine, which is an amino acid that plays a very important role in healing that intestinal lining, or even products like Restore that can help to rapidly upregulate or allow the immune system to heal in a healthy way that small intestine lining. Of course, a lot of this should be done in the right right order, depending on what a person's dealing with, so that they're not having symptoms or problems with the healing process. So now sometimes if you add things in too quickly, if someone's got a really beat up digestive system, it can start to cause some detox symptoms that can be pretty nasty. So many times it helps if we can monitor and regulate people through that process. But it's a very important process, because as we heal that digestive lining, a lot of those same nutrients can also help heal that blood-brain barrier that I talked about last time, which starts to help with protecting your brain more, so you don't have toxins moving into the brain that should not have been there to begin with due to the breakdown of that blood-brain barrier. So there's some very important factors that we like to walk people through as far as a process in the healing of the digestive system. The next part of the digestive system that I'd like to talk about is the large intestine, and that portion of your digestion is basically receiving all of the waste product from the small intestine. There's a valve between the small and large intestine called the ileocecal valve, and sometimes that valve it's kind of like an O-ring that with a muscle where it can contract or relax. So if something's causing irritation to that valve and it decides it wants to contract, it can cause problems with the bowels moving properly. So it can cause constipation. Sometimes we'll instruct people to actually massage that area of the intestines to try to relax that muscle and open that valve up if they tend to have more constipation issues. And that would actually be on the right side of the lower abdomen, where that ileocecal valve would be located. But waste product from the small intestine goes into the bowel and the large intestine, and the healthy bacteria, the good flora in that bowel, should further break down that waste, as well as healthy fibers, and those flora should also start to cause a forming of that waste byproduct into a formed stool. Now, in the large intestine, it's important that this good bacteria is really staying in check, because the good bacteria actually set up a slightly acidic balance in that bowel, keeping bad pathogens from growing and flourishing. Now, if that healthy flora gets disrupted from a really poor diet, where there's maybe a lot of consumption of meats that have from animals that have been given hormones, or foods that have a lot of pesticides on them, different vegetables or different insecticides on them. Sometimes these chemicals actually will go after and destroy healthy flora, healthy bacteria, or even, of course, the infamous antibiotic use or overprescribed choice of medication for infections and so forth. Of course, there's a time and place for it, but many times it's overprescribed, which is like a bomb going off in your large intestine, killing a lot of healthy, good flora. And when this gets disrupted, if the good flora doesn't recolonize, or if it's not repopulated quick enough, the bad bacteria or bad pathogens can overtake that bowel and create the wrong type of environment, the wrong pH, so that the bad flora can keep flourishing and the good flora really can't keep up. When this happens, it can start to create problems with more lower abdominal bloating, maybe bad putrid, gas that a person might be getting. It could cause constipation or diarrhea, flipping back and forth. A lot of the symptoms that medical doctors like to kind of slap a Band-Aid name on, and they call it IBS, or irritable bowel syndrome. So the question I always have is, well, what is IBS? It's great that you have a name for it, but what's really going on? What's the root cause of it? And many times what I'm talking about is the root cause of it. So if a person has these things going on and their flora is out of balance, some of the things to start to do, or at least that we start working on, is teaching people to eat foods like fermented foods that have more good bacteria in them, like maybe raw fermented cabbage, sauerkraut, things like that, coconut kefir. Also slowly introducing different types of probiotics into the system and rotating those probiotics so you're getting different strains, and also getting the prebiotics in. So probiotics are kind of like the seed that, like grass seed that you put into the dirt. Putting probiotics into the intestine is like putting seeds into the ground so that the flora is more present. But prebiotics is like fertilizing the good bacteria that is already there so that it populates on its own. So a prebiotic fiber, one of them is called inulin, which is from chicory root, and another one's called acacia, which is a different type of substance or fiber that can help with populating your own good flora. So there's a couple of ideas and understanding of the intestinal tract that hopefully will edify you and help you to become a little more on top of your own digestive health. And it's been a joy to talk about the digestive.
Thanks for joining us today on the Total Health Podcast. If you'd like more information about how Total Health can transform your health, check them out. They would love to set up a free consultation with you over the phone. Call them at 262-251-2929 to make that appointment. Otherwise, you can check them out on the web at www.totalhealthinc.com.